Before I introduced our distinguished panelists, I wanted to share a little bit about the R Street Institute and why we are uniquely positioned to have this important conversation today. For those of you who may not be familiar with R Street, we are a think tank headquartered in Washington, D.C., focused on solving complex public policy challenges through a free market and limited but effective government lens. Our mission is to offer pragmatic, real solutions that foster American innovation through competition while safeguarding individual liberties. Central to R Street is the understanding that life in a democracy sometimes means reaching compromises that don't necessarily represent first or even always best solutions. And I think you're going to hear a little bit about that approach to compromise here with our panelists this morning. R Street is upfront about the ideology that underpins its research, but we stand apart from many other think tanks in that we are not constrained by partisan labels. And as a result, we can take an objective, problem-solving approach to complicated economic and societal challenges. And it also means that we're free to cultivate relationships with a diverse group of policymakers, scholars, and partners. So, of course, it's hard to separate out today's conversation about helping American families from the fact that we're in the throes of an election season. I'd like to say it's one like no other, but it's actually exactly like the last one. So here we are. And family issues don't often pop up on polls. The economy, however, consistently ranks as voters' leading concern. And even this year, when issues like immigration and foreign affairs are top of mind for many voters, an Economist YouGov poll just last week found that 73% of voters ranked the economy as very important, a full 20 points more than immigration, 30 points more than climate change, and 25 points more than foreign affairs. And this is significant because historically, when researchers dig a little deeper into what about the economy voters are concerned about, voters typically point to jobs and personal finances. So the economy has, in effect, become a catch-all term for how people feel they're doing. And it's a reflection of affordability and opportunity for upward mobility. So all of this is to say that families are feeling the pinch. Some of it is economic, some of it is a function of shifts in societal and cultural norms, but these challenges are all bipartisan. So we're here today to ask, how can we do more to prioritize families? Should we be prioritizing families? What public policies would help families stop struggling and start thriving? And where do we draw the line between what the government can and should do and what individual families and communities must do for themselves? So here with us today to discuss all of this are three exceptional experts in this field. Jacob Bastian is an assistant professor of economics at Rutgers University. His research focuses on how public policy can reduce poverty and increase economic opportunity while limiting unintended consequences. His work has been published widely in the American Economic Journal, Journal of Public Economics, Journal of Labor Economics, and National Tax Journal. Last year, Jacob worked on a study for R Street titled Designing a Better Child Tax Credit, Accounting for Effects on Poverty, Parental Employment, and Government Budgets, which I know we will discuss today and we will put in the chat for you to access. Tim Carney wears many hats. He is a senior fellow at the American Enterprise Institute, where he focuses on civil society, family, economic competition, religion in America, as well as electoral politics. He's also a senior columnist at the Washington Examiner, and he is the author of several books, including his forthcoming work, Family Unfriendly: How Our Culture Made Raising Kids Much Harder Than It Needs to Be. And perhaps most relevant to this conversation, Tim is also the father to 6 children. Courtney Jocelyn is R Street's resident fellow for our Project for Women and Families. Courtney's work explores the intersection of economic mobility and women's health. Specifically, Courtney's research has focused on the role modern contraception has had on women's and families' economic mobility and success, and how expanding access to contraception has now been widely adopted by both many in the Republican and Democratic parties. Courtney will share more about the role this and other indirect policies can play in supporting our families. So with that, let's get started. We're going to begin with a quick round robin. Jacob, I'll start with you. In just a few sentences, please tell us what is the single most important public policy recommendation you would implement to help American families today? And then we'll go to Courtney and Tim.
Great. Well, I'm very happy to be here. Thanks for having me. If I could wave a magic wand, I would do two things. I would create a beefed up child tax credit with monthly benefits for all families, especially the poorest families, whether or not they work. And the second thing I would do is I would create a beefed up earned income tax credit that continues to top up the wages of hardworking, especially low income families, raising the next generation of Americans.
Courtney, we'll pass the baton to you.
Sure. So pulling maybe a little bit of a bait and switch, given the contraceptive access piece, but I think probably the most important thing right now, especially federally, is looking at pandemic era telehealth policies and ensuring that we're maintaining some of those to encourage equitable access to healthcare.
Tim.
So I think the main problem for families is not economic or policy related, it's cultural related. So I would look for policies that help change the culture. And the simplest way to put it is sidewalks, walkability. And walkability addresses lots of things. For one thing, places where people walk are safer. More importantly, what parents need and what kids need is more independence. Probably a lot of you guys saw that recent op-ed that the huge spike in childhood anxiety is due to a lack of independent play. Parental exhaustion is due to driving their kids everywhere because either there's 3 lanes in both directions and the kids can't walk, or you have to take kids to every activity they might have. So walkability, but not just walkability, kid walkability and kid bikeability. That's where the policies that I think are most important.
Thank you, guys. So I jotted down what our big pictures are from the child tax credit, the earned income tax credit, telehealth policies, and sidewalks. We're going to take a few minutes to dig a little deeper into each of these. Jacob, I'll start with you. Last month, the House passed the Tax Relief for American Families and Workers Act, 357 to 70, so wildly popular. It's now in the hands of the Senate. If passed, this legislation would modestly expand the child tax credit by sort of incrementally raising the refundable portion of the cap, or the amount families would see in a refund check. And all of this is intended to ease the economic burden on families. But, take us back a little bit, because we're not really talking about the differences of a few $100s, are we? I think the longstanding question surrounding the child tax credit is, does it actually alleviate poverty? And perhaps equally important, does it reduce the incentive for parents to work? Your work obviously directly addresses these questions, so hopefully you can shed some light on this for us.
Thanks, Sabrina. Yes, I think this is super important. And I think a lot of people in this debate have the same goal in mind. We want to increase opportunity for families. We want to see poverty reduced. We want to see positive long-run outcomes. So to talk a little bit about the child tax credit, this is a program that a lot of people have heard of. It's taken a lot of iterations. It's seen a lot of variations over the last few years. So the biggest version was in 2021. There were monthly benefits available to families. Benefits were worth up to $3,000 per year, $3,600 for young kids. And we know that in 2021, child poverty fell to a record low 5.2%. That was fantastic news. And for context, in the 1990s, child poverty was in the 20s. I mean, it was 28% in 1993. And so one of the lessons I took, and a lot of researchers took, is that poverty, in part, is a policy choice. And the combination of the earned income tax credit and the child tax credit can have a big reduction in child poverty. Now, in theory, some people think that, okay, that's good in the short run, but actually in the long run, what if there's big work disincentives that could offset this impact on poverty? A lot of families maybe would fall into poverty. Now, even though that's true in theory, my research and my reading of the literature is that this is a little overblown, and that while some parents would choose to stop working, this would still lead to millions of kids being pulled out of poverty. And so right now we're talking about kind of a smaller version of the child tax credit than what we saw in 2021, but one that would still pull many kids out of poverty and help many hardworking families just, pay the bill and, just kind of reward hard work. And so I think that the bill that passed the House is a step in the right direction. And as the Senate takes it up, we'll see what happens. My fingers are crossed, and I hope we do that, and then, continue to tinker and continue to make improvements for this policy.
Tim, as I said at the top, that our street is focused on reaching pragmatic, real solutions. You've also been writing about the child tax credit as of late. And in fact, last week or a week before, in a recent Wall Street Journal article, you make the conservative case for expanding the child tax credit. And you talk about it being about basic fairness. So seeing that this is an election year, what are some of the features of the child tax credit that both Republicans and Democrats can support?
Thank you. Yes. So the child tax credit that was, as it was created after the Tax Cuts and Jobs Act, before sort of the Biden era temporary expansion, I thought was a very good one. In part, all it did was replace, it kept the old child tax credit. You had a doubled standard deduction, but we got rid of what you guys might remember, which was a individual and a personal and dependent exemption. That's an important idea that just captured the fact that bigger households have more people in it. I mean, we all know there's standard deduction, the way the tax rates work. If you don't have either a large exemption for every person in the household or a child tax credit plus a large standard deduction, that the example I used in the Wall Street Journal was a family of 5 would pay twice as much federal income taxes on the same income as 5 bachelors who live next door and, are all driving Ubers or working as baristas. So that's why it's a basic fairness measure. So I liked the TCJA one. It wasn't indexed to inflation. It's lost 15% of its value. The current House bill indexes it to inflation, not unfortunately to its 2017 level, but adds a little bit. And in the future, it will go up with inflation. There's other things that I would add. I mean, I'm sensitive to this because my oldest turns 17 at the end of the year, and I lose my child tax credit at the beginning of the year. It should go until your kid is out of that, is done with high school, basically. There's other things I would do involving clearing up, and I like the way Romney and Daines approach it, sort of move work support over to the EITC, move the EITC's family support over to paying for increasing the child tax credit. I don't think Jacob would disagree with that stuff. I don't necessarily love a massive one. I do think we have to worry about disincentive to work and disincentive to marriage. If getting married reduces the benefit you get, then the federal government's in a position of harming children by disincentivizing marriage. But I do think index it to inflation, make it a little bit bigger. Those things can be agreed on, and some increase. They're not making it totally refundable to the lower income. They're doing sort of a compromise. And so for that reason, I think it's good. I don't think, and unfortunately, we might find out that it's a big disincentive to work, but I think that trying it is worthwhile.
Mm-hmm. And it is a small, we're talking about, $100 and then $200.
A few $100s
to
lower income families who have to work to get it. Yeah.
Correct. And, before I pivot to Courtney, I wanted to ask Jacob if you wanted to respond at all, because I know the earned income tax credit is also top of mind for you. And I'm curious if you wanted to add any additional thoughts on sort of what role that plays in this conversation.
I think Tim raised a lot of good points. I mean, for me, the earned income tax credit is a great policy. It encourages work. It essentially tops up wages for low-income people. So, if a lot of people have a hard time paying rent, housing costs are rising, people have a hard time. So I think the idea of topping up wages, not just for people with kids, but for everybody, I think is a good idea. So I think the earned income tax credit as a wage subsidy is a good idea. I think designing it in a way that does not discourage marriage is also a good idea. I think that's something that's happened about 20 years ago. They tried to reduce the marriage penalty. But I think in thinking about the child tax credit, the earned income tax credit, there's kind of trade-offs here. We want to help, we don't want to penalize single parents, but we also don't want to, discourage marriage. And so I think it just requires policymakers to think hard about this. But maybe the one area that maybe me and Tim would slightly disagree is just, I would be in favor of a pretty substantial child tax credit, but designed in such a way that, we're not creating a big phase out benefit cliff that's going to discourage work.
Mm.
You know, I think we want to help families and encourage work.
So maybe we can pivot for a moment. I want to bring Courtney into this conversation. We've obviously been discussing some of the ways the government can help families through direct financial support. But as you've emphasized, the economic cost of raising a family goes beyond just dollars and cents. Can you speak a little bit more to that?
Yeah, absolutely, Sabrina. So a 2023 report by LendingTree found that the cost of raising a young child increased 20% between 2016 and 2021. And not totally surprisingly, the biggest chunk of money that goes toward raising a child in that report is childcare. But there is a difference between financial cost and economic cost. So the financial cost of a child can be added up, right, between housing and food and childcare, et cetera. But the economic cost is a bigger picture and includes less explicit costs. So things like healthcare, labor flexibility for when a child gets sick and and the child has to stay home from school, other things like transportation, time taken out of your day for that, similar kind of to what Tim was saying. So when I talk about the cost of families, what I'm concerned about is ensuring these time-consuming things are less so. And I'll give an example of what I mean. So prior to the pandemic, not many people you spoke to had used telehealth to talk to their family doctor. But of course, when the pandemic hit, states quickly enacted temporary allowances for people to use virtual healthcare. So if your child got sick, you could even use FaceTime to talk to your doctor. Now, FaceTime isn't exactly HIPAA compliant, but the point was that whatever families had to do to get time with the doctor virtually, they could do it, and their insurance would probably cover it. And this was a major shift, with the majority of people saying that they wanted to keep using telehealth for future health issues. And there are many telehealth options even today, as some states have been making permanent telehealth allowances. But there are a couple of considerable gaps that are making it disproportionately expensive for lower income families to access healthcare. So a study under the Department of HHS found that the use of pediatric preventive services declined during the pandemic, which isn't totally surprising. I think overall people were accessing healthcare a little bit less. But what they also found was that this was especially true for lower income families, as well as Black, Latino, and Asian children. So there was a bigger gap for pediatric preventive services for minorities and lower income families. And additionally, the CDC noted that children in rural areas face higher barriers to healthcare. This is particularly true for children with mental, behavioral, and developmental disorders. It's simply harder to get to a regular doctor appointment when you live far away from a major metropolitan area, or if you're working an hourly job with fewer opportunities to take multiple hours at a time off. So while telehealth has been a fantastic innovation overall, if we're leaving behind some of those more vulnerable populations, then we're making it economically more expensive for them to stay healthy, which has some really big long-term effects, right? So healthcare costs in general to an insurer are higher when people have, conditions that aren't treated initially. Preventive screening can go a long way to prevent healthcare costs down the road. So we're seeing a great leap with telehealth, but we're sort of leaving some of those most vulnerable populations out of it in some ways. People in rural areas access telehealth less. They have less access to things like broadband, which is an issue that Congress has been grappling with. So there's just a lot of things to think about when thinking about good telehealth policy. And then another quick note there is maternal health. Most of us are probably aware that the maternal mortality rate has increased over the past several years, and it's quite frankly higher than it should be for the United States. So this is another issue to be addressed via telehealth. I don't want to sound like totally doom and gloom about these issues with telehealth, but there are a few reform options that are being debated in Congress. So one avenue of change is the Healthy Moms and Babies Act, which was introduced by Senator Grassley. And it would require that state Medicaid programs increase the use of telehealth for pregnant and postpartum women in order to improve health outcomes. Another big question mark this year is whether pandemic-era telehealth policies surrounding reimbursement rates for providers, especially at clinics serving lower-income areas and in-person visits, the rules surrounding those reimbursement rates. So all of this is to say that we can't afford to roll back telehealth policies and risk making it harder for minorities and lower income households to access healthcare. But we can't leave folks behind due to poorly written rules.
And Courtney, do you know, or can you bring our audience sort of up to speed on where Congress is with the Healthy Moms and Babies Act, or sort of what the trajectory looks like at this point?
Absolutely. So this bill has been referred to committee, but it has not made very many steps past that, which I think in part can probably be due to some of the circus that we've seen over the past few months in Congress in general. A lot of things aren't making a lot of progress, but this is a pivotal year for not only that, but some of the reimbursement fights that are happening that the administration has said they support, but it really boils down to what Congress gets done this session.
Thank
And
you.
Sabrina, could I just quickly
Please, yeah.
pile on to that? It really is, I mean, as you mentioned, we have 6 kids, and so we've learned a lot in the process of when it's, and you can just imagine somebody going to an emergency room, spending 6 hours, and then finding all you needed was an allergy medicine. And you can imagine somebody thinking, I just can't afford to go for something that's probably minor, and it being horrible. My wife and I benefit from having multiple MDs, including pediatricians that we went to college with, whom we can text. Okay. We benefit from learning over time what's an ear infection, what's not an ear infection, et cetera. And that these are privileges that we have, that anything that the healthcare system for so many people, it's just this massive hurdle. Yes, you go to the emergency when you break your arm, this massive gray area that parents don't know what to do, and it's a huge cost when it ends up being minor, or it seems like a huge cost for something minor that ends up being major. Anything like these telehealth things that can make that easier and get rid of the huge sort of asymmetry in information would be a huge benefit to especially lower income parents, but frankly all parents.
Absolutely. I'm laughing because the other day I did call a doctor for one of my children, and I asked for an appointment, and they told me they were booking for next February. And I said, oh, you mean like right now? And they said, no, 2025. And I said, well, it sounds like you need more doctors. And they said, no, we just have a lot of demand. And I said, oh, okay. We won't get into supply and demand right now, but I do think that there's something to be said for telehealth helping with that demand, because you can sort of triage how many, kids actually have to come into the office and parents have to take time off of work. Just to sort of, continue with this thread that Courtney started us on, in which helping American families does not always require a direct government intervention. Tim, in your forthcoming book, which you are leaving shortly to start speaking about this afternoon, what can parents and communities do to make raising children easier and to sort of ease this burden that people feel is there? Obviously, sidewalks would be great, but I have a feeling you argue in your book that we need to escape the travel team trap. We have to abandon helicopter parenting, strengthen communities, change the workplace, and ultimately restore the belief that humans are good. So maybe you can give us the 30,000-foot view of that.
Yep. So there was actually an interesting comment by my AI colleague, Angela Rashidi, who said that if you look at the costs of raising kids, aside from housing in the last few years, the actual cost hasn't gone up relative to wages, but it feels so much more expensive because people don't have the supports that traditionally have come from community and extended family. And so that is what I focus on mostly in Family Unfriendly, which is, again, do you have a local rec baseball team that your kid can ride a bike to? It seems like a small thing, but it really is important for kids' mental health, for parents' mental health, for parents' ability to have the family size they want. There was that Pew survey or Gallup a few weeks ago. The ideal family size is 2.7 children. The actual family size in the US is 1.6, 1.7. So a whole child short. So things that make it easier for people to have the family size they want would include, again, the changing of the culture. You mentioned the travel team trap. this is something that communities really have to lead on. It's hard for an individual parent to say, okay, I'll put my kid in rec baseball if the little league is falling apart because all the good pitchers are playing travel ball, and the parents are afraid of falling behind. It could be a school that just says, you know what, no, we don't want you playing travel ball during the season, and a little league that says, hey, we're going to really push for all the parents, from the stud pitcher with a slider at age 13 down to the kid who doesn't know which way to hold the bat. We're going to put you all in little league. That's sort of a community-led thing to understand. The point of youth sports is not to produce Major League Baseball players. It's to let kids run around, to give them activity, give them the experience as teammates, as leaders, as followers, as winners, as losers. All of that stuff is important. And the communities have to lead, because a lot of parents end up going with the flow. And so my goal is let's help change the flow on this. And then you mentioned one last comment. You mentioned helicopter parenting. I used to live in Silver Spring, Maryland, where free range parents, one particular family got arrested at least once. They got in trouble multiple times for letting their kids walk to the playground. It was a 10-year-old and an 8-year-old. They taught them how to walk. They made them stay together. They had them do it during daylight hours. And the police decided that that was totally unsafe. So they took the kids away from the parents. Talk about harming children in the name of protecting children. And so there are places that have been passing laws to say, actually, no, you can leave a 10-year-old in charge of an 8-year-old, in walking distance. You can allow kids to be babysitting their own siblings at a younger age. It takes laws to offset this, but the culture generally needs to accept we need to give children independence, and we need to make sure that the streets, et cetera, are safe for them to be independent. And all of that relieves the burden on parents. If you think everything you do for your kids, you either need the government for or you need to pay for, yes, parenting becomes unaffordable in America. If we change the culture, that can support families, and you don't just rely on the state or the market.
And that can help parents across the economic spectrum, right? Because it's not just, upper middle class families who are sort of contending with these issues.
Yes.
We always joke that we should have had one more kid, but they would probably be feral in the current environment that we live in, because there simply would not be any more time or room in the car to drive them anywhere. So they'd be supporting
There are
themselves.
worse things than being feral.
I'd love to
So,
just jump in and
yeah,
support
please,
Tim,
Jacob.
just to support Tim on this. So as a former free range child myself, I feel like, I benefited from that. And I kind of wonder how much of this is perception, because, when I was a kid, national crime stats were actually a lot higher than they are now, but there's a perception that things are less safe now. So I don't know how you bridge that gap of understanding, but like Tim said, you want your kids to walk around to the park by themselves. You want them to walk around safely. Actually, crime's a lot lower than it was, 30 years ago. And so that's just interesting, even though people feel like it's less safe. So I don't know what you do about that, but it's interesting.
Well, next time we'll have to invite our criminal justice team onto the panel as well. I do feel like perhaps this free range approach to parenting might be even harder policy to build support for than the child tax credit, but we're going to get there, little by little, each of us contributing. I want to pivot for a minute to election season. It is here, if you hadn't noticed. It's happening every day. What are some of the themes that you all think we might be hearing about the next couple of months? And then also, and Jacob, maybe we can start with you. What is the cost of doing nothing? What happens if our whether we're talking about Congress or our presidential candidates, what happens if they simply don't act the way we're asking them to?
I mean, it's a big question. Status quo is always an option, but we can do better. I mean, we can help more families. We can address the issue of the debt and the deficit, and I think we can do both at the same time. And I'm not going to say a whole lot right here. I think I'll let my co-panelists say more, but I think that it would be a shame to just let the status quo happen, because TCJA is going to expire at the end of 2025. Some big decisions need to be made. Personally, I believe in a progressive tax system to help increase opportunity among those in the bottom half. And so I hope we continue to design policy with that in mind.
Tim or Courtney, feel free to jump in.
Courtney, go ahead.
Sure. So there are a couple of really big things on the line this year with Congress. So as I kind of alluded to earlier, a lot of pandemic era telehealth rules are set to expire. So for example, the DEA has said that at the end of this year, 2024, they will revert back to prescribing rules, pre-pandemic era prescribing rules, with maybe a few exceptions here and there, but there is a chance to make those permanent. So this was basically the idea that you can receive prescriptions from a doctor via telehealth, even if you've not seen that doctor in person before. And this has become a wildly popular policy. In fact, the DEA extended it by a year due to the backlash they got for saying they would revert back to pre-pandemic era rules in 2023. So that's on the line this year. Again, you're seeing also reimbursement rates happening, a fight over reimbursement rates. And basically what that boils down to is if you're a doctor and you're providing telehealth services and your patient has insurance that's covering it, is it reimbursing you at the same consultation rate as if you saw them in person? And this has been a big struggle with providers in general. Their argument being that with lower reimbursement rates, they're not making as much money in being a healthcare provider, so they're less likely to do it. So there's kind of a chicken or the egg situation here, which is, are you providing fewer telehealth services because you don't make as much money, or are people not seeking out as much telehealth? So there's a big discussion there happening in provider land right now over reimbursement. So those are some really big things happening this year. And as I mentioned earlier, it's become so popular to use telehealth for healthcare, especially lower level healthcare issues, that to sort of turn the clock back to 2019 on some of these telehealth policies would just be pretty dangerous, I think, for healthcare access and the way we've gotten used to accessing healthcare. So that's a big one. And then another one, which I can get into later, is looking at what's going to happen with contraceptive access. As most of you may have seen, our Kellyanne Conway was out saying that the GOP really needs to focus on things like birth control policy this year. We'll see if that happens with it being an election year. I know that basically anything can happen, and I won't make too many predictions because as soon as I do, they'll go the opposite direction. So,
well, I'm glad that you brought that up, and I do think it's worth maybe just taking another minute on, it seems as though this has become more of a bipartisan issue now, the idea of expanding contraception. Do you think that this is being motivated with families in mind, or is there another sort of force at play?
I think it depends on who you talk to. There are a lot of folks that we've spoken with who are concerned about birth control access with families in mind. One thing that came out of also the pandemic was that families reported wanting more children, kind of to Tim's point, than they had, but they were worried about the economic cost. All right. A lot of people were concerned about their own economic future during the pandemic as the world was shifting more rapidly than we had seen. And so there was sort of this gap between we want something, but we're worried about sort of what that will cost us. So in between, right, how do you help families achieve those goals? One is obviously to lower the cost overall economically of having and raising a child, but also just meeting them where they are, letting them have the tools they need to plan for their families. And so, of course, birth control comes into play there. The World Health Organization named, modern contraception as one of the greatest 20th century health achievements. For good reason. It's been linked to a ton of positive outcomes in society, things like lower divorce rates, higher educational attainment for women, higher earnings for women, just a lot of things that sort of come with being able to better plan for your family. But there's been, I think, a lot of confusion over the last couple of years over what that looks like. Depends on who you talk to if it's really got families in mind, but we can't ignore that this has really only been a net positive for families having access to birth control, as well as survey says basically all Americans want better access to birth control. And that's the same whether you're, whether you're talking about, or if you're looking at sort of the overall picture of the Americans saying that they support better birth control access, it's the same whether you sort of cross-section that by political affiliation, religious affiliation, marital status, age, all of those things. People are generally in favor of better access.
So it sounds like it might be something that we hear on the campaign trail in the next 6-7 months. Tim, do you want to jump in a little bit about what else we might expect from our candidates?
Well, I think what you see right now is a very interesting debates internally on both sides. And if we're going to rerun the same two guys, both of them have been either undecided or not thought about these debates. On the Republican side, there's long been a sometimes either a libertarian leaning or interesting twists on it, a worry about welfare queens, that if too large of a child tax credit or too large of an EITC, people will spend the money wrong and they'll and so that's a worry. Maybe we should, and that's driven towards, well, let's guide the funding towards certain things rather than a large child tax credit. On the other hand, you've got Marco Rubio, you've got a lot of voices on the right, Mitt Romney, two guys who are both saying we need to support families, which is a conservative thing. I mean, when the marriage rate is so low and the birth rate is so low, if you think family is good, then they're saying, okay, how can we support families without it being a massive government expenditure? So like sort of pro-family versus if you have your family, that's your own deal on the right. On the left, there's the sort of, do we give people piles of money or do we help subsidize childcare? Now, if you pay close attention to the Democrats who are talking about subsidizing childcare, they always end up talking about GDP. Often, because of labor unions and interests like that, they often end up saying we need to help boost the childcare industry. I think boosting the GDP, subsidizing people going back to work, and subsidizing the childcare industry are very different things than helping families. There's some overlap, but they're two different things. And so, and both of these, I know who I'm rooting for. I'm rooting for the pro-family guys, not the total either libertarian or anti-welfare queen or the pro-childcare industry people. So those are two internal debates. In the Biden administration, you've got people on both sides of that. Would we rather give families money that they could spend how they want, or would we rather subsidize childcare? And on the Republican side, the question is, we haven't heard Trump talk about either of these things. He's not the most clear policy proposer in the world. And so who in his campaign or theoretical administration would get to the top position and how would they steer them? So I'm looking at those intramural battles on both parties.
Right. And we want to make sure that we, largely are able to give people the ability to make the choices that are best for their family. So if they have a grandparent who can help care, but that's not a government certified child care center, does that mean that they can't benefit from any kind of tax break? Jacob, I do want to turn this back to economics for a second and ask you, we're a think tank that looks at these issues from a free market, limited, but effective government lens. We're not keen usually on picking winners and losers through the tax code and through other regulatory policies. Sort of how do we thread that needle here? Obviously, we do see the benefits of families and the stability that comes from that. But at the same time, how do we not slip into a winners versus losers mentality here?
Yeah, it's a good question. I think the goal of most policymakers and the public is to help families. I think some people are more concerned than others about unintended consequences. I think that is kind of the crux to, child tax credit, earned income tax credit, child care policy, like different things. I think it comes down to how big do you think the unintended consequences are going to be? And so that's why I'm a fan of letting parents opt in. So if you choose to work, the earned income tax credit's there for you. With the child tax credit, I think a nice hybrid approach would be, to kind of, maybe find some bipartisan proposal that I wrote about with R Street would be the following. So imagine a child tax credit where some benefits are available to everybody, whether or not they work. Maybe depending on your preference, maybe it's $500 a month, maybe it's $500 a year, $2,000 a year per child. And then you have additional benefits that phase in with work. And this could balance, the efforts of some to help the poorest families, but also minimize unintended consequences. So something like that could help. Since Tim mentioned childcare, I think this is also another super important topic and something that it's a complicated market. I mean, anybody who's ever looked for childcare, it's expensive. There's not a lot of options out there. And so it seems to me like some combination of maybe public subsidies with some type of Silicon Valley smart person who can create like a Airbnb style app or something. I don't know, but it's so expensive. And I would love to see, for parents who want to take advantage of childcare, who don't have a neighbor, a relative who can help out with that, I would like to see, a larger supply of childcare, which would allow an increase of labor supply for parents who want to work. And I think that would, yes, that would have implications for GDP and everything, but I don't know if that's necessarily the main goal. I think the main goal is just to increase options for families.
Can I just jump in on sort of how you would do that? Subsidizing demand is how our government tends to try to help people. And we know that that drives up prices. We know college prices are higher because of subsidies for student loans. We know home prices are higher because of subsidies. And multiple studies, and I cite a couple of them in my book, have suggested that the same thing happens with childcare, that giving more money to people who want to buy it ends up driving up the price. The word you used, Jacob, was supply. Are there things the government could do to help increase the supply of decent childcare, particularly in the places that don't have it? So I'm not saying necessarily, I don't have any ideas, but that would be my main thing, is don't just subsidize demand. I feel like this is a very R Street thing to say, particularly if you just subsidize demand, you're not making it more affordable for the average person.
I love that. And I'll just jump on for one more second. So I would love to see both reductions in barriers to creating like a small home-based child care center. And then maybe there would be some type of supply side subsidy. In 2021, there were, during the pandemic, American Rescue Plan did have some supply side subsidies, which the goal at the time was just to keep the lights on and keep childcare centers open. It turns out they were able to, enroll more kids and pay their workers more, which, hey, that sounds good too. But I agree with you. We don't want to just juice the demand side and drive up prices. So I think thinking about the supply side, especially in childcare markets, is underappreciated and very important.
I mean, sometimes on the regulatory side as well, right? Can we eliminate some of the sort of unnecessary regulations that aren't necessarily keeping children safer or more engaged, but are just making it more expensive for a childcare facility to employ more people? And then that leads us into education and so many other things that we don't have time to talk about today. We do have a couple of questions from listeners, and I just want to address some of those. One of them is, how do the panelists feel about some of the more experimental ideas around child savings accounts or bonds? Obviously, the devil is in the details, but are these promising ideas in principle, or do they miss the mark?
I'll jump in. I'll say I actually think one of the changes I would make to the child tax credit is allowing parents to shift the money earlier. So things that I don't know that there's a great bang for the buck if there's expenditure for helping kids have money sort of later in their childhood and in their later teen years, because the reason to move money earlier in the whole parenthood journey, is a bigger check, be more incentive. I care about this shortfall between the 1.7 babies and the 2.7 ideal. Moving it earlier sort of psychologically does that. Parents, when they're younger, when their kids are younger, they're younger, they make less money. So it'd sort of be an income smoothing thing. And people who do pay for childcare expenses, those are going to be much greater in the earlier years. So anything that's talking about giving parents money when their kids are older, or giving kids money when they're older, I think will have less bang for the buck than moving stuff up to, even a birth bonus is the side that I would err on rather than that.
I put a thought in the chat. I don't know if it's visible to everybody, but yeah, the economist Derek Hamilton has written a lot on this idea of baby bonds, and I think it's a pretty interesting idea. I think it would be an interesting way to close class gaps, race gaps in terms of wealth. And the idea would be, you know, a baby's born, you give them a bond, it accrues over time. When they turn 18 or 21 or whatever you decide, I mean, you know, details TBD, but I think it would be an interesting way to invest in kids and to reduce, you know, especially race and class wealth gaps, which are huge in this country.
Right. In the last few minutes, I wanted to pivot a little bit to one other area that I know all four of us are benefiting from, and presumably everyone who's participating here today, and that is sort of the future of work and how this post-pandemic hybrid work environment is helping families, and how, you know, sort of what are some of the risks that we face looking ahead, especially as we see cities that are having trouble themselves in terms of economic progress. Tim, maybe you or Courtney, if you both want to jump in here, talk a little bit about sort of what our employers can do to alleviate some of the stresses on families.
So I'll go with a couple of ideas. I think similar to what we've seen with healthcare in the last few years, it's just been, you know, most people got to experience some level of working remotely or virtually as well. So we're just sort of in the middle of still a lot of dust in the air on what's going to happen, right? When we were entering the pandemic, people were making predictions, myself included, that either we were going to see higher divorce rates or more children, you know, born out of the pandemic, and we were going to see home prices crash because, you know, everyone is going to be basically sick of being home. So I think there's a lot of predictions around like the future of work too, that are like, everyone's going to be working remotely. And then you see some op-eds that are like, no, everyone's going to go back to the office because we're going to sort of miss that culture of being in person. So, you know, at the risk of not making, or at the risk of making more predictions in that space, essentially what I think we can expect is that whatever happens, bring this back to sort of what Congress is doing now, whatever happens this year with Congress to do with like healthcare policy, with childcare policy, with these earned income tax credit, the child tax credit, that's really going to determine a lot of people's sort of planning for their futures, right? Are they able to stay home more easily and keep their job? That's a huge labor flexibility thing, whether you can work remotely or not, right? Again, going back to childcare or, you know, healthcare issues. How often, you know, do you have to take an hour here or there because, oh, I've got a telehealth appointment? That's way faster to get to than to say, I've got to go to a specialist and they're across town. And then you wait, you know, an hour and a half, 2 hours. So I think the ability to have labor flexibility overall is going to really determine what families think they can manage to do both in their careers and with their families. And kind of going back to the point of people want more children than they currently have, I think that's really going to have an effect on whether they think they can have more children responsibly, right? There's a lot of economic concern over that in general, and I think that depending on how we sort of set the stage this year will determine whether people feel equipped to have more children. And the last thing I'll say on labor flexibility is that there's a lot to dig into on things like, you know, people working in the gig economy. What restrictions is the government putting on them to be in the gig economy? This is something that I think is particularly important, both for younger people, but also for women who choose to stay home with their children. Gig economy jobs are way more flexible for them to do, right? They can be a DoorDash driver when they want to, because they're not required to be on a schedule, and they can make that additional money. But we've seen this in a lot of places, California, of course, being the biggest one. They try to put a lot of restrictions on people trying to work in those jobs, and then they end up not wanting to work in those. The cost goes up. People aren't using those services as much. So I think there's a lot to talk about on the spectrum of labor flexibility that you can do to help families, both indirectly and directly.
Absolutely. So Claudia Golden, an economist who just won a Nobel Prize, she wrote something a decade ago that bears directly on this. She said the pay gap between men and women is almost entirely due to the fact that mothers demand flexibility. Now,
Yep.
one of the arguments I make in Family Unfriendly is dads, you should be demanding flexibility too. But the other thing is that flexibility is one of the great ways to reduce sort of the opportunity costs of having kids. And so it absolutely, if you look at polls, and I crunched a lot of them, and the magic wand that Jacob referred to earlier, if mothers could raise a magic wand, wave a magic wand, most of them would move into a job where they work from home or very close to home. They're there to drop off the kids and pick them up, or when the school bus drops them off and picks them up. That's the dream for a majority of American moms. For some of them, that would mean working more. They don't have that option. For most of them, it would mean working less, because again, we have this on and off switch, some of it by regulation, some of it by just sort of old habits. You're either full-time or you're sort of a part-time 1099 contractor. So absolutely everything Courtney said about flexibility, about part-time gigs and that sort of thing is absolutely, that's the main thing that parents need. And just to tie it to the childcare stuff we talked about earlier, one of the things, one of the ways a larger tax credit could discourage work would be by helping convince one of two married parents to drop into a part-time job. That would be good for the family. In other words, they're not going to spend their extra money on childcare. They're going to earn a little less money and move into a part-time job where not only are they there for their kids when they get off the bus, that means they are there to run the girls' soccer team at 3 o'clock as well. So it's good for the whole community. So especially in the context of two-parent households, the flexibility that a child tax credit would create, combined with the regulatory reform, the employers reforming the way they do it, would be massive.
And Tim, you probably recall, I worked on a conjoint experiment a number of years back on just this issue related to what unmarried versus married women would demand in the workplace, and unmarried women, not surprisingly, and perhaps like in a very good way, were prioritizing salary, as they should. They have very few demands on them, but unmarried women were prioritizing time off and workplace flexibility to the tune of up to $10,000 less in salary, right? They're willing to make that trade-off because that flexibility was so important. And I think that's key. And we want to maintain a labor force that allows people to make those trade-offs for themselves. And I should put a plug in for our street. Our street very much lets people make those trade-offs for themselves and decide what the best work environment and benefit structure is for them. So yay for us being forward-thinking leaders in the think tank space. Any final words? We have a couple last minutes. Jacob, would you like to sort of help us close things out?
Yeah, I'll just kind of pivot from what Tim just said and then close out. But the goal of public policy is not to get parental employment as high as possible. That's not the only objective of policymakers, or at least it shouldn't be. The goal should be to raise, to encourage, to support, healthy families. So for a lot of parents, that means working. For some parents, it's going to mean part-time work. For other parents, it's going to mean not paid work. Almost all parents are working. It's just a question of whether they're in the paid labor force or not. All parents are doing things that benefit society and their families and their communities. We should be supporting that and giving them the option of whether to work. So just because you see parental employment tick up or tick down, you really want to look at other metrics to determine whether in the short run and the long run policies are helping families. And so we have a lot of evidence on helping low-income families. And yes, that has good effects on the short run. And also in the long run, these kids, they're healthier. They're more likely to finish high school. They are more likely to work and earn more and be, tax-paying citizens when they grow up. And so these should be, some of the goals that policymakers have in mind in designing policies to actually help families.
Courtney, any final thoughts from you?
Yeah, I was just gonna let people know, I mean, if you kind of hear the undercurrent of everything that we're saying here, it's that flexibility and discretion are things that families really benefit from. And so in the majority of these cases, right, what we're not saying is that, well, we need to start a new program, we need to start a new agency to, head the family economic mobility agency or whatever. It's more about getting government to step out of the way. They can provide some very important tools and direct assistance, as we've talked about with the child tax credit and the earned income tax credit. But overall, what we're talking about is sort of getting their fingers out of the pots and saying, give families discretion, give them the labor flexibility, give them the childcare flexibility that they need to thrive, instead of, you know, putting strings attached to everything. So there is this overarching theme, I think, of getting out of the way, and kind of to Jacob's point, we're not saying that everything needs to be taken advantage of to the max. It's your ability to take advantage of those at all, right? And find what works best for you and your family.
That's fantastic. And Tim, last words?
Yeah, I'll zoom up to a higher altitude. I'm a small L liberal, which generally means, you know, let people do what they want, let people have choice. Generally, government policy should be neutral. But what I came to realize while writing my book is I don't actually want us to be neutral on family. In other words, I think we should be neutral on whether Jacob buys an electric car or a gasoline car. I think we should be neutral on whether a developer builds, you know, an office building or housing. I don't think we should be neutral on family. I think that we should, because a tax code should be pro people, and pro family means pro baby, and babies are human. And so this means specifically that policymaker, this is a sort of more philosophical way of putting, I think, part of what Jacob was saying. Policymakers should say, we want you to be able to have kids. That pronatalism in some ways isn't neutral, but in some ways is so natural for a government for the people, especially in this day when we have this record low marriage and birth rates that are falling so short of the ideal. So that would be my overall thing. Don't be afraid. If you say, I want to help families, but you're afraid that doesn't sound neutral, don't be afraid. Go ahead. I want to help families. We got nothing against people who aren't going to have them, but we're going to help families because that's what we do.
Well, thank you all for this really engaging conversation. I'm realizing we could probably be here for another hour, and we can invite in many of our colleagues who are working on related topics, but we'll save that for the next time. I do hope everyone will visit the R Street website. If you didn't get a copy of Jacob's paper in the chat, you can find it there, as well as much of Courtney's great work. And Tim, I'm sure we have something of yours floating around as well. So visit the R Street website, please, and we will see you at our next event. Thank you so much.